name is Randy Bigley. Joining me on the podcast right now, new to the podcast, Gentiva Hospice. Hello, it's Julie Kirk. Hi, Julie.
Hi, I am Julie. It's
Yes.
great to be here.
Great to meet you, Julie. And you're from you guys are, your branch is out of Marion, correct?
Correct. So the name of our company is Gentiva. We were
Mhm.
formerly known as Kindred Hospice.
Mm-hmm.
Our branch is located in Marion. We have multiple branches, but I work out of our Marion branch.
And you were telling me you're the biggest hospice company around, right? Correct?
We are, yes, we are. Pleased to say we are the largest hospice company in the nation.
Wow.
So with that comes, we have a lot of resources to
Yeah.
provide to our patients and families.
Now, locally, where do you serve out of the Marion building?
So out of our Marion branch,
Mhm.
we service Marion and the surrounding counties, including Delaware, Hardin, Crawford, Morrow, and Wyandotte counties.
So quite a big area.
It is, and the nice thing is that if we do have a need that is in an area out of our service area, we have different locations, so we're able to partner with our other branches to be able to coordinate services for patients even out of our service area.
If people, they hear the word hospice, right? They think, oh, this is it, this is the end. That's not what hospice means. What does hospice actually mean, actually?
So hospice is comfort care at end of life. We really focus on managing symptoms and giving people that quality of life. We're focused on the quality of life and helping them to feel the best that they can for whatever time is remaining. And when I say end of life, historically people would think of hospice as, someone in the active dying stage at the very end of life. But it's truly evolved over the years to where patients are signing into our program earlier rather than later. There are certain guidelines that have to be met because hospice is a Medicare benefit, but we really focus on educating the community about the benefits of coming on service with us sooner rather than later, because we're able to really provide that care and support to the patient family when they come on a little sooner.
And we talk about, the patient, but you work with the family a lot too, right?
We are. Hospice is truly as much about supporting the family as it is about the patient. And we also, even after a patient passes, we provide bereavement support to the family for 13 months after the patient passes.
So, what do you do, like, hospice, what all does it entitle? What all is hospice?
So we have a whole team of individuals who provide different services to our patients. And some of those include the RN case manager who oversees the care, assist with medication management, and really focuses on that symptom management piece to be able to make sure that our patients are feeling the best that they can. And then we also have aides who can provide personal care. We have social workers, spiritual care, and we have volunteers as well for companionship. All of those services are optional. The one service our patients and families have to have is that RN case manager, because he or she is the one overseeing the care. But I always encourage everybody, take advantage of it. Take advantage of all of those services. If there's something that you don't want, at least try it out, because, the way I see it, the more support, the better.
Sure, and you guys do a lot then. I mean, it's not just sitting with somebody as they're passing. It's a lot more to it, isn't it? That's why I said I don't think people understand exactly what hospice is,
They don't. Yeah. Unfortunately, there's a lot of stigma with the word.
Yeah,
they hear the word hospice, it induces panic. And I really am passionate about focusing on that education piece with the community, because a lot of times patients and families come on service with us and they're like, this is not what I thought at all. Why didn't we do this sooner? It truly is a gift to be able to bring that to them. And I'm just, really passionate about trying to dispel the myths and misconceptions that people have.
Sure. I bet it's a very rewarding job, isn't it?
It truly is.
Yeah.
I've been a nurse for 12 years.
Yeah.
The last 7 have been my hospice career. I started out as a case manager taking care of patients. And from cardiac nursing to home health to hospice, it is truly the most rewarding field I've ever worked in.
You get to meet some great people, don't you?
Amazing people.
Yeah. And hospice doesn't mean this, you'll have like a week or two to live. I mean, you said you've had people 3 years or so.
Yeah, we have some on service that we've had for years, and even personally, when I was a case manager, I had several that I took care of for just over 3 years. It really depends on at what point the patient or family decides to sign on into the program. As I mentioned earlier, there are certain Medicare guidelines that have to be met to be eligible for hospice, but now patients are most of the time admitting sooner rather than later, and then they're getting that full benefit. You know, when they're on service for, you know, months or years, they build that trust and relationship in the team that's taking care of them, and they benefit from that support and that symptom management piece as well.
Are you always looking for volunteers?
We are always looking for volunteers, yes. So that can be anything from providing bedside companionship to we even have volunteers who come into the office who help with more administrative work. So yes, we definitely are looking to add more to our team.
Brings me to our next question. How do you become a volunteer for hospice?
So anybody interested in becoming a volunteer can reach out to our office. Susan Snyder is our volunteer coordinator, and we'll be happy to provide information. I can give out our main number if that would be helpful.
Yeah, go ahead.
So our main office is 740-223-3452. So anyone interested can reach out, and we'll be happy to answer questions, to provide information to help them if they're thinking about that.
I've been able to talk to some hospice volunteers and just hear the great stories that they have and how they meet these incredible people and how rewarding it is for the volunteer also, you know?
It truly is. Yeah, and like I said, we have a variety of things that they're able to help with. If they're not, sometimes people say, oh no, I don't think I can do bedside volunteer, and that's okay. While we love and appreciate that, we also appreciate any help, and what, you know, we meet them where they're at. If they would rather come in and help in the office, we can do that as well. We appreciate it.
And how can somebody get more information on hospice? Is it the same number that you gave out?
Yeah, so our main number again is 740-223-3452. My role at Gentiva, I'm a hospice care consultant, even though I am a nurse by trade. So I meet with patients and families in the community, provide information. We can even have just question and answer meetings. There's no obligation to sign on with us. So yeah, anybody interested can call in, and I'm happy to talk with them and help in any way we can.
Do you have a website too?
Yeah, we do. So we're on the web. If you Google Gentiva, we'll come right up, and there's more information on there. And also, if you call in and there's further information you'd like me to email, I can do that as well.
Awesome. Julie, thank you for coming in. I like getting the news out about hospice. It's not what you think it is, right?
It really isn't, and I'm passionate about educating our community and just bringing the gift of hospice to as many people as we can.
Awesome. Thank you so much, and I hope we get some more volunteers for you. And
Thank you. Yes, we will welcome that, and thank you so much for having me.
And I tell you, if you're thinking about volunteering, talk to a volunteer, and they'll tell you how great it is. Right?
Yes,
Right.
We have many volunteers who'd be happy to talk with anybody interested.
Julie, it's great meeting you. Thank you so much for coming in today.
Thank you for having me.
Thank you.